Hello, today is the day 43rd of 365 days project and I'm here to explain about the tests done for diarrhea. Let's see. Most of the cases resolve without treatment and a doctor will often be able to diagnose the problem without the use of test. However, in severe cases, a stool test may be necessary, especially if the symptoms persist for longer than a week. The doctor may recommend further tests if the person has signs of fever or dehydration, stools with blood or pus, severe pain, low blood pressure, a weakened immune system, recent travel history, recently received antibiotics or been in the hospital, diarrhea persisting for longer than 1 week. If a person has chronic or persistent diarrhea, the person will order tests according to the suspect cause. These may include a full blood count, anemia, may suggest malnutrition, bleeding, ulcerations or IBD, liver function test, test for malabsorption, erythrocyte sedimentation rate and C-reactive protein, test for antibiotics, stool test. Doctors can identify parasites, bacteria and a few viruses in the stool cultures. Stool tests can also rival the microscopic blood, white blood cells and other clues for diagnosis. Prevention and treatment. Key measures to prevent diarrhea include access to safe drinking water, use of improved sanitation, hand washing with soap. There is an evidence to suggest that interventions from public health bodies to promote hand washing can reduce diarrhea rates by 1/3. Exclusive breastfeeding for the first 6 months of the life. Personal and good hygiene, food hygiene, health education about how infections spread, and retrovirus vaccination. Key measures to treat diarrhea including the following: rehydration with oral rehydration salts (ORS) solution. ORS is a mixture of clean water, sugar, and salt. It costs a few cents per treatment. ORS is absorbed in the small intestine and replaces the water and electrolytes lost in the feces. Zinc supplements. Zinc supplements reduce the duration of diarrhea episode by 25% and associated with 30% reduction in stool volume. Dehydration with intravenous fluids in case of severe dehydration or shock. Nutrient-rich foods. The Vicky's scale of malnutrition and diarrhea can be broken by continuing to give nutrient-rich foods including breast milk during an episode and by giving a nutritious diet including exclusive breastfeeding for the first 6 months of life to children who they are well. Consulting a health professional in particular for management of persistent diarrhea or when there is a blood in stool or if there are signs of dehydration. Let's see the myths and truths of diarrhea. First one, should we drink less fluids when we have diarrhea? On contrary, it is absolutely essential to keep your fluid intake high to prevent dehydration from loss of body fluids. Drinking boiled or treated water is advised by medical professionals. If one feels the urge to vomit, sips of water must be taken at frequent intervals. Home remedy for replacing lost fluids with an oral rehydration solution may help to prevent dehydration. To 1 glass of boiled and cold water, add 1 spoon of sugar and a pinch of salt. Keep stirring it, sugar dissolves and consume. Second, should be careful what you eat whilst we are experiencing diarrhea. Experts are divided on what it is acceptable and what times when it comes to food. However, the general consensus is that one should avoid fatty, oily and spicy food. If you are not feeling up to it, not eating anything will not do you any harm provided your fluid intake remains uncompromised. What is the WHO response? WHO works on member states and other partners, promote national policies and investments that support case management of diarrhea and its complication, as well as increasing access to safe drinking water and sanitation in developing countries. Conduct research to develop and test new diarrhea prevention and control strategies in this area. Build capacity in implementing prevention interventions including sanitation. Develop new health interventions such as retrovirus immunization and help to train health workers especially at the community level. What is the goal of WHO? ending preventable deaths from pneumonia and diarrhea by 2025. Pneumonia and diarrhea together account for 29% of all children deaths globally, resulting in deaths of more than 2 million children each year. Children living in poor or remote communities are more at risk. The goal is to see a drop in deaths from pneumonia to fewer than 3 children in 1000 live births and from diarrhea to less than 1 in 1000 by 2025. Thank you.